In the United States, colorectal cancer is the third leading cause of cancer-related deaths in both men and women. In this week's Health Check, I'm joined by gastroenterologist from WVU Medicine Camden Clark Medical Center, Dr. Mohammed Barakat, to learn more about the importance of screening for colon cancers and what colorectal cancer is. Dr. Barakat, thank you so much for joining me.
Thank you for having me today.
Of course. Now, the first thing I want to ask you about is colorectal cancer. So just for people out there maybe wondering what it is, can you tell us a little bit about it, maybe signs, symptoms that you may have it as well?
Colorectal cancer, also known as colon cancer or rectal cancer, is one of the leading causes of death in America from solid cancers. And it's a cancer that arises from the colon or from the rectum. And typically, it's asymptomatic when it first starts because it's small, it doesn't produce any symptoms, and that's why screening for it as part of preventative health is very important. And as it grows, it starts to become symptomatic, and patients may experience change in their bowel habits. They may develop a constipation. They may see some rectal bleeding, unintentional weight loss, and other symptoms that prompt further investigation. But the goal of colorectal cancer screening is actually to find these, while they're small, still treatable before they become a big problem and before they spread throughout the body and become uncurable.
Okay, and so now, is this a cancer that maybe affects more younger people, older people? Is it kind of open to anyone out there?
Historically, we used to screen patients for colorectal cancer starting at age 50.
Okay.
However, new evidence shows that there is a surge in the incidence of colorectal cancer in younger patients, and now the United States Preventive Task Force has changed the screening guidelines to incorporate those patients at 45 and above. So that is the new screening guideline. We now start screening at 45. Now, obviously, as we age, there is a higher risk of developing colon cancer with patients in their 7th and 8th decade having an increased risk.
Okay, and so I want to ask too, why is it so important to, screen for colon cancer or colorectal cancer specifically?
The earlier you discover the cancer, or what we call polyps, which are precancerous, the easier it is to take care of it. So in a nutshell, it's a preventable cancer. So that's why we screen for it. We try and find them before they become a big problem. We try to find polyps before they turn into a cancer, and that way we mitigate the risk of developing colon cancer.
And so if you had to give advice to people that are watching us right now, what would you say would maybe be the best way to kind of prevent getting colon cancer or any other kinds of forms of cancer that relate to this?
So I think the most important thing is to be proactive and to seek health care. Talk to your primary care physician, get screened for colon cancer. Now, there are many ways to get screened for colon cancer. There are stool-based tests, like a Cologuard, which is done every 3 years, unless if it's abnormal. There is a test called an FIT, which is done annually. And then the gold standard is considered a colonoscopy, which can be done up to every 10 years, depending on the patient's risk. Colonoscopy allows us to visualize polyps and treat them at the same time. So it allows us to intervene and also detect these polyps.
Okay, and so before I let you go, Dr. Barakat, is there anything else, whether it's about colon cancer, screening, prevention, signs and symptoms, anything else that you might want to add for the viewers?
I think, there's a misconception about colonoscopy. First of all, it's a very safe test. Complications are very, very rare. The prep seems daunting to many people, but it's actually not as difficult as people may seem to believe. We currently have preps that involve tablets, that involve low volume of liquid, and they allow us to have good visualization of the colon. So the procedure itself takes maybe 10 to 15 minutes. Patients are not under a general anesthesia for them. We use a special type of anesthetic, which allows them to recover very quickly, and they don't require any type of assistance. So overall, colonoscopy is very safe. It is the gold standard for colon cancer screening, and talk to your primary care physician, get screened as soon as you can.
Absolutely. Well, Dr. Barakat, thank you so much for joining me here on set. It was a pleasure to hear about all this wonderful knowledge you can share with the Mid-Ohio Valley about such an important topic.
Thank you for having me.
Of course. Mid-Ohio Valley, when we return, Kirk Greenfield has one last look at your forecast. Stay with us.